So my name's Deniece O'Leary. I'm a physician assistant who works in family practice here in Ontario, Canada.
And how did you get into the PA role?
I was interested in going to medical school. I looked into it quite a bit. I was living in Southern California, and the university that I went to did have a medical program, so I specifically chose the school for the program. And then as I started getting closer towards graduating, I started looking into physiotherapy and seeing what else interests me. And I heard about the physician assistant program from one of the schools that I was looking at. And it was a great combination of doing lots of different types of medicine, so not always doing the same thing for your entire career. I was very interested at that time in dermatology, in orthopedic surgery, and in family practice and women's health. And they were very clear through the medical school program that you'd have to pick one and that's your whole career. And I thought that's not good enough. I want to go and do more than one thing for the rest of my career. So I wanted some more flexibility. So when I started looking into the physician assistant role, that's exactly what it gave me, is the flexibility to do different types of medicine. So once I started practicing, I was very interested in teaching as well. So I started practicing in family practice in a low-income practice down in Southern California. And then I moved up to Ontario, Canada to help as the physician assistant program started at McMaster University, and fulfilled that dream of being able to teach. And then I was also interested in dermatology, so I've been able to work with a dermatologist for a few years here in Ontario, as well as family practice and an orthopedic surgeon as well.
So what are the main differences you've noticed between being a PA, a family PA in the U.S., or specifically California, versus here in Canada?
Yeah, so it's quite a bit different. It's mainly the scope of practice and the acceptance and the understanding of patients and other healthcare providers and government, for sure. Again, it's very difficult because you're comparing with one place who's had physician assistants for 50 years and another place who we have had them here for 10 years, but it hasn't been a great number practicing for 10 years. So there's such a small number of physician assistants that are coming out. It's much more difficult, I think, for us to make a huge impact very quickly. That being said, it was a slow process through the States too, and I wasn't around at the beginning of the process, so I'm sure if you talk to some of those people, they'd be very similar stories of it being kind of a slow pattern. Some of the differences, so in the States we do have, at least in California, we have DEA numbers, which allow you to prescribe narcotics, so that's a big difference between Ontario and California specifically. Sometimes the medical directives are a little bit different that we use here in Ontario versus like more of a practice agreement type of delegation of services in California. And I would say just the reimbursement is one of the other biggest concerns, is that we had specific billing numbers in California, so we could bill for the services for the insurance companies and to the Medicare and Medi-Cal programs, the government programs, where we don't have a really good funding model yet here in Ontario.
And was there a big difference between how you functioned in your day-to-day activities as a PA in California versus here in Ontario?
No, I would say it's quite similar to how I function daily. At the practice in California, I was fairly autonomous. The physicians were in the office most of the time, but they were running with their own list of patients as well. So if I needed them, I was able to ask them a question at the end of the day or the end of the week, but there wasn't a lot of interaction. Here I find that there has been a bit more interaction, and it's just been because it's a newer role. So as the physicians I'm working with are learning and understanding the scope of practice, as they're teaching me all the nuances here in Ontario of, you can't get an MRI tomorrow for a shoulder rotator cuff tear, which was one of the fun things I learned in my first week at the clinic at Stone Church. So I think it's just learning the different ways to navigate the system and where you can find what and what type of specialists will do different things. I wasn't used to, for example, orthopedic surgeons only doing shoulders or only doing knees. The company that we used to send patients in California did a pretty wide spectrum of orthopedics. So different nuances like that, and just kind of a little bit more teamwork here, which I really do love. I get to work with dietitians, mental health counselors, pharmacists, lots of different roles, nurse practitioners. So it's a little bit more diverse with the collaborative care, which I really enjoy.
And as an American PA, was it difficult to find work as a PA in Canada?
So I had a really unique experience because I was brought here to help with the teaching for the program. So I had like a specific visa to teach for the program. I'm not sure exactly how easy or challenging it is for other Americans if they're interested in coming up. I do get contacted quite frequently by other Americans that are interested or that have family up here in Canada. If they are Canadian citizens, it's much easier. If they were just an American citizen wanting to move up here to practice, they would need to get some type of work visa, and their work would have to sponsor them to bring them up, which could be possible, but would probably be expensive and a fairly lengthy process. The other thing too is the Ontario PAs a lot of times are looking for work, so it's trying to make sure that it's a job that somebody can't do that's already here in Ontario.
Can Canadian trained PAs obtain work in the United States as a PA?
So Canadian trained or trained anywhere in the world other than in the U.S. cannot practice in the U.S. So if you wanted to practice in the U.S., you have to graduate from an ARC PA program, which are only the programs that are within the U.S. So it has to be one of those programs, and then you have to sit to take the national certification exam in the States. So as of now, the way that it stands is that people who are PAs that work in the Netherlands and Germany and anywhere else in the world, in the Middle East, they're not able to go to the U.S. and take the exam and work as a physician assistant.
Okay, can you speak to what it was like switching specialties or how that's occurred in your career?
Yeah, so I did start out in family practice. I've had a strong interest in dermatology and in orthopedic surgery. Typically in Southern California, I did do a rotation in dermatology, and with the sun being so beautiful in Southern California, we had a lot of skin cancers. So in the family practice, I probably did at least 10 to 12 procedures a week of removing basal cells, doing biopsies, some biopsies for malignant melanomas, some white excisions as well. So a lot of dermatology procedures, the physicians and some of the other PAs in the groups would refer them to me, and then I would take care of them, or if it was something that I couldn't handle, I would send it out to the dermatologist. When I came here to Canada, I started in family practice and with the teaching, but there was a post for a dermatology PA, so I did work part-time as I was still working in family practice, doing some dermatology and helping with some biopsies and some diagnoses. One of the biggest challenges, though, is the lack of the funding model, so that's made it really difficult, even though the physicians I work with, are quite happy with working with a PA and they see the value of it. It's really difficult when the healthcare system hasn't caught up with the collaborative care approach. So that's made it a bit challenging for a lot of the different specialists that I talk with as well, even the ones that I don't work with. Switching over, I did a bit more family practice and then was lucky enough to have the opportunity to do a 1-year maternity leave with an orthopedic surgeon, which was wonderful. So I got to brush up a lot on my skills for shoulders and upper extremities. We did a little bit of sports medicine and knees as well. I really enjoyed being able to do kind of the orthopedics aspect of it. Would love in the future to be able to do some orthopedic surgery. In the States, there's a lot of surgical first assist and first assist in all different types of specialties. So it would be great to be able to do that at some point in my career as well.
Awesome. Can you walk us through what a day in the life is like as a family med PA here in Hamilton?
It's definitely very busy. On a daily basis, I probably see between about 20 to 26 patients, depending on how busy it is. There's a lot of preventative health care. So for preventative health care, we do immunizations, we do well children visits, we do pap smears. For chronic disease prevention, we'll see diabetic patients, patients with asthma, COPD, diabetes, of course, any other chronic illness. I do see still a fair amount of dermatology as well, patients with psoriasis. And then for acute care, there's different things for acute care that we see. We see patients with abdominal pain, we see coughs, colds, lots of different types of acute care problems, injuries from work, headaches, leg pain, tons of fatigue, no shortage of patients with fatigue, and sometimes shortness of breath or chest pain, high blood pressure, so lots of different patients on a daily basis. We try to book a lot of our patients ahead of time, but we always try to keep at least about 6 same-day appointments available so that they can come in and see me if they need to.
And how is it determined whether the patient sees you or the physician? Are you two interchangeable?
So it really is up to the scheduling of if he's in one clinic and I'm in a different clinic, or if we're both in the same clinic. If they need an earlier appointment, I tend to work earlier in the day. So if they want an early appointment, they'll be with me. The patients can request. So a lot of times the patients will request to see me. I do all of the women's health and the babies, the well babies. So those tend to get booked with me as well. And then sometimes it depends on how complex the patient is. So sometimes I might see them for a couple of visits and then I'll refer them over to have their next visit with the doctor that I work with, to make sure that they can have that follow-up care. And then if we need to get a specialist involved, we can as well.
So what would you tell a patient that has never seen a doctor before what to expect when they're going to see you?
If they haven't seen the doctor before?
Or sorry, I've not seen a PA before.
Okay. So when I go in, I always introduce myself that I'm a physician assistant, and I let them know. Sometimes they have questions about what types of things I can help them with. So I let them know the type of patients that I see, the fact that we can write prescriptions through delegation through the physician, which is usually one of their biggest questions, is if they need to come back for a separate appointment for their prescription refills, or if we can take care of everything at the same time. And through those medical directives, that's something that I can explain to them, that I can take care of whatever their needs are. And if it is something that's above my scope of practice, I'm able to ask the physician and have him either come in and take a look at the patient as well, or we're able to talk about the patient's coordination of care, and then be able to kind of move the case forward for whatever else we need to do.
So how often are you interacting with your supervising physician?
So we see each other every day in the clinic, and then we do make sure to talk about complex cases at least once a week, if not more often if we need to. And then if there's specific questions, we do have like an instant messaging through the EMR system, so we can use that as well. And if I've got a question and he's not in the clinic, I'm always able to call him as well.
And what differences has the clinic or the practice have noticed since adding you on as a PA? What's changed?
We're able to see a lot more patients, for sure. So it is very busy. It is very quick-paced in the clinic. It's a lot of fun. It's a lot of fun to be able to work with the patients and work with the team. There's really good coordination of care now, where we're able to do a lot more preventative care. There's also a lot of interaction with the patients. I find the patients really enjoy coming to the clinic, which is an unusual thing to have them say, but they feel really comfortable. I've had patients that I've talked to with different transgender issues and different things like that, that as I get to know them and as I get to know their families more, they feel very comfortable, which is wonderful to see that they're willing to open up and let us help them with their health care. A lot of times they do refer other family members, cousins, neighbors, friends. We get to see pretty much lots of people that they know.
Excellent. And have you've worked in 2 specialties, so you've worked in family, so primary care, as well as other specialties. What are some of the challenges in family care that you don't notice as much in other specialties? Or how are they different?
One of the biggest, I guess I would say the two biggest challenges. The first is the breadth of knowledge that you have to have for family medicine. So you don't need to be an expert because we can always refer to the specialist, but you need to be quite good at multiple different areas. So you need to make sure that when you're going through school that you're learning a lot about the lungs and a lot about the endocrinology system. There's no shortage of patients with all kinds of different things on a daily basis. So I'll see somebody with throat pain, I'll see somebody with MSK problems, there can be neurological problems. So there's just such a breadth of information as well as medications to make sure that you're for example, if you go to a conference, there's going to be all kinds of different information sessions that you're going to want to go to almost everything because everything is very applicable in family practice. I find with a specialty practice, I went to a dermatology conference in Indiana, and the dermatology conference was great because it was so specialized. You could do little tiny bits of really intricate information of dermatology or very specific procedures. So it was very focused. But with family medicine, it's just extremely broad. The second thing is the coordination of care. So sometimes when I'm referring somebody out because I want them to get, for example, I want them to get an EMG, and they get the EMG done, but then the information comes back to me. Now I need to refer them back out to a physiatrist or to a neurologist to be able to take that case a little bit further and to be able to help the patient. So sometimes it's the coordination of care where we want a test and we want a consult can be a little bit challenging, especially when some of the specialists are very specialized with what they do. So trying to navigate the system can be a bit more of a challenge in a family practice with the thousands of specialists we deal with.
Okay, and what do you enjoy about being a PA?
Everything. I love working with the patients. I love working with the interprofessional team for sure. I like the trust that the patients put in us and the trust that we have to put in the patients that they're trying to do the best for their health care that they can. I really like doing a lot of preventative medicine, so trying to keep patients as healthy as they can and making sure that they trust us to come in and take care of them when there is a problem. I love the fact that we can change scopes of practice. I've used that quite a bit. But just to be able to do lots of different things. And if you are a little bit tired and bored of your job, for example, if you work in a secretary position or something that's very specific, you can change to different areas. You could work in a hospital, or you could work in a doctor's office, or you could work in a legal office, something different. A lot of times in medicine you can't do that. You can't switch over to a different practice if you're a physician. So at least being a physician assistant, it gives me that flexibility to keep changing. If I get bored with something, I can just change to something else. And if I decide that I really loved what I was doing before, I'm able to change back. So I think that's really unique for our profession. I really like the networking as well. So knowing a lot of the physician assistants in Ontario and being able to see them at different dinners and conferences and being able to catch up on all the new things as we're kind of blazing a trail forward, being able to see how we can all work together to be able to improve the profession and really establish the profession as a great profession here in Ontario.
Do you have any calls to action or any suggestions that you want to say for physician assistants in Canada? What should they be doing more of? What do you think would be helpful for the profession at this point in time?
I think the most helpful, honestly, is the advocacy. Obviously, in our individual practices, we're huge advocates. Our patients know us, they trust us, the staff knows us, but outside of our little tiny silos, I think it's really important to make sure to get involved as far as writing the Minister of Health, writing the MPPs, letting them know what a great job we're doing. I'm definitely sometimes guilty of that as well. I do a good job at work, at least I think I do, but having the time and the energy to tell everybody else about what you're doing and to explain how you're making a difference. I think if a lot of us did that more often, it would be very apparent how we're able to impact the healthcare system and how much more we could impact the healthcare system if that scope of practice is really realized and if the billing aspect and the regulation comes in with it, so that we can kind of make sure that we're helping the healthcare system as much as we can, saving them money, and also really being able to benefit the physicians and the hospitals that we work with being able to have a really good life balance.
And if there's a physician that's kind of interested in hiring a PA or working with one, what would you tell them?
I definitely do talk to physicians that are interested. I kind of try to give them a little roadmap. I start with talking with them first about why they're interested in a PA, what their need is for the office or for the hospital, because I want to make sure that they're really looking for a physician assistant, that they're not just looking for an assistant or a secretary or something else, that they really understand what our scope is. I find out a little bit about how much they know about physician assistants, so if they have worked in the States before, or if they've talked with somebody who has a physician assistant, and take that opportunity to kind of educate them a bit more, and then find out how I can help. So if there's something specific that they're looking for, or if they really have a unique situation, which I would say many do, of what they're looking for and what they're interested in getting, and those kind of deliverables that they can see how they can make their practice better. So I usually have multiple conversations trying to make sure that it's going to be a good fit for somebody to work in that clinic or in the hospital.
Can you tell us what you're doing?
So I'm just looking through the different consult notes that we've got from specialists. Also going through the mail, so if we've got any EKGs, chest x-rays, ultrasounds, anything like that, just being able to go through and see if we need to have the patients come back in for a visit, or if everything's okay.